everybody. Thanks for stopping by to this presentation. I'm Nolan Fisher. I'm one of the third-year physical medicine and rehabilitation residents at the Cleveland Clinic. I'm going to talk to you a little bit today about our Cadaver simulation for ultrasound-guided musculoskeletal injections. This is a new course that we have developed here at the Cleveland Clinic along with some of our faculty in order to provide better training and better competence of these injections. So the background on these injections are that we have traditionally been taught landmark guided injections of major joints. The ultrasound allows us to perform more accurate and new injections that we previously couldn't just do based on landmark guidance. Traditionally, this has been used for corticosteroid injections, and more recently, the use of biologics and regenerative therapy has gone into this field. Research has shown that these ultrasound-guided injections are much more accurate and therefore provide an efficacy that is at or better than the landmark-guided injections. Typically, this ultrasound-guided injection is not taught during a residency program, and because the ultrasound is becoming much more popular, it has started to become part of residency and fellowship training programs. We believe that in a PM&R residency, we should be competent and be able to perform the ultrasound-guided injections prior to graduation. This course was first started about a year and a half ago with our current chief resident, Dr. Brandon King, Ali Esfahani, who is a fellow with our spine program now, and some of the other residents in our program, and then was taught by Dr. Dapul, who is an attending and now associate program director within our program. We did over about 18 months. We had the equivalent to 12 injection workshops. This happened in the Cadaver lab. They were typically 2-hour sessions that occurred from around 7 in the morning till 9 o'clock in the morning. During these sessions, we would focus on typically one part of the body, whether it be the shoulder, the hip, elbow, knee, wrist, hand, foot, and ankle, and do 2 to 3 injections, as well as diagnostic strategies and pathologies that are typically treated with these injections. The outcomes of this were very successful. Discussing this course with my other fellow residents and those that have graduated last year that got to experience it as well, they thought that this is a big step in the right direction for our teaching. It allows us to get several reps of injections on cadavers in a low-stress environment. This allows us to provide better injections on live patients and allow us to be more comfortable when performing on live patients. I think the outcomes of this will result in a better teaching experience for the attendings that are associated with our residency program. And then I think whenever we graduate residency, we'll be more competent physicians and be ready to go out in the community and practice these injections by ourselves. As far as further research goes, we think it would be very useful to get some actual hard data on the comfort of residents, the quality for which the injections were performed before and after the Cadaver workshop, and see if what we feel is backed up with the numbers. Again, thanks for stopping by. We'd like to give acknowledgments to Dr. Dapul for helping teach the initial iteration of this workshop, Dr. John Lee, who is our program director, for supporting us in our academic pursuits. And then, of course, we'd like to thank Anthony at the Cadaver lab on main campus of the Cleveland Clinic. He's just the best, and he's willing to go out of his way to set things up and make things work well for us. Thanks again for stopping by. Have a great day.